All right. Hello, everyone. Dr. Eric, the fitness physician, and another cool episode of the Relentless Vitality Podcast. I'm super excited to have another awesome guest on, Dr. Christine Bashara from New York. And she's got a lot of really cool content, a lot of stuff that resonates with me and my mindset. And you know how I think about a lot of stuff. So we're going to talk about the gut health. We're going to talk about how to optimize your gut. We're going to talk about weight loss, fighting viruses and COVID and all kinds of cool stuff. So Christine, like I said, is out of New York. She's a longtime researcher and a board certified physician, and she actually published the first scientific study linking a certain gut bacteria and to COVID infections, and talks about a lot about that, which we'll get into today. She does a lot of cool stuff with integrative medical weight loss, gut health, and the gut brain axis, and so much more. So, Christine, welcome to the show.
Thank you so much for having me. I'm really looking forward to this conversation.
Absolutely. So you've got a really cool backstory, and I know you probably said it many times. So feel free to make it as short as you want or as long as you want. But people know me, how I got into what I do. But if you don't mind, if anything you want to add to your intro or talk about your story, I know you kind of were ahead of the curve and kind of learning about fasting and losing weight and getting into gut health, and then got into what you do now. So tell us a bit about you and your practice, what you do, and we'll fire off some questions after that.
Yeah, absolutely. I feel like a lot of us kind of stumble upon what we're passionate about from personal experiences, and that's kind of what led me to what I do today too. I was an obese teenager, and at the age of 15, I was like in the BMI range of obese, and I remember the pediatrician told me that I was getting up there and I would never be able to lose the weight. And for me, hearing that, I'm that kind of mindset where if you tell me not to do something or you're not able to do something, I kind of go the opposite. So I started experimenting with dieting, eating healthy. And at the time, I started thinking, you know what, let me see what's going to happen if I don't eat during certain times. So I started kind of a restricted time eating during that time. And I found that I was losing weight a lot more quickly. But also what really kind of resonated with me at the time was how mentally focused I was, and really improved mental, function as well. So I literally been practicing intermittent fasting for many years. And this is really why I love that. And when you go to medical school and then you start studying all these biochemical pathways, you're like, oh, this totally makes sense. So my journey, my personal journey into nutrition and weight loss has really what caused me to be more passionate about that and to try to help people and teach people that really your body is the best doctor. It knows what to do. It's always on survival mode. It just kind of needs a little bit of help, but I'm a big believer in, your body's really, really smart.
Awesome. No, I love that. Yeah, you're so right. And I think we've learned so much, especially with the gut and the microbiome. Every day, I think we learn more and more what we don't know and how complex it is, and how those aged, wise physicians, even all the way back to Hippocrates, kind of knew that, right? Disease begins in the gut, et cetera. It's pretty cool. So let's jump right into the gut. I'd love for you to talk about, the gut and the microbiome specifically. I know you're big on boosting the certain strains, especially the quote unquote good bacteria, right? And then I would definitely want to talk about Bifido, Akkermansia, some of the other ones, how to do that, etc. So let's, feel free to just
Yeah.
run.
Yeah. I mean, it's funny because the gut, we know a lot about the gut, but we really don't know a lot about the gut. And I think it's just this emerging field of medicine that I think is going to blow up. It's already blowing up, but I feel
Right.
like in the next 5 to 10 years, the gut is going to be the forefront of everything, in my opinion.
I agree.
And so regarding bifidobacterium, which is my favorite gut microbe, we kind of stumbled upon that discovery too. And it's funny, I know when you were introducing me, you said I've done a lot of research. I actually am not a researcher. I kind of just researched this specifically during COVID because I had a little bit more time on my hands. But the interesting thing is I'm a big believer in this, and I'm willing to risk my medical reputation on this. I believe that people who are deficient or had no bifidobacterium in their gut are the ones who really either succumbed to COVID or had really bad reactions. And the fact that children's guts are so different from adults, and they have so much bifidobacterium in their gut just as this protective mechanism, right? When they're younger and they're developing their immune system, they have this really potent beneficial bacteria in their gut. Approximately 67% of their gut is with bifidobacterium. And so they did so much better than we did as adults in COVID because of this. Because not only that, but when you start kind of looking at the functions of bifidobacterium, it actually downregulates the same immune pathways that COVID was affecting. So you kind of put two and two together, and you come up with this conclusion. You're like, this is amazing. You know, our gut is really what's helping us regulate our immune health. I mean, a large part of our immune system is in our gut, which a lot of people don't even realize. So, and we have these, microorganisms living in our gut that communicate with our brain. They communicate with our immune system. They help to make all these wonderful byproducts that really send signals everywhere in the body. So, if there's a take-home message, it's make sure you're trying to increase your really beneficial gut microbes, which we know there are some. We don't know all of them, but definitely the three that are really big are bifidobacterium, lactobacillus, and Akkermansia, which we've seen time and time again, are present in people who are healthier, thinner, and deficient in people who have chronic medical conditions, obesity, et cetera. So yeah, I mean, my goal, and I think we're aligned in that, is to really optimize lifestyle, diet, health to increase these beneficial microbes that are working really hard in our gut.
Yeah, for sure, for sure. I think, and I've talked on some videos about, as you, and I think you have as well, with especially, not only the inflammatory pathways, boosting the anti-inflammatory pathways and cytokines like IL-10, and then of course like the short chain fatty acids, especially butyrate. I know there's been an explosion of research in butyrate and some of the other short chain fatty acids, which and their benefits in terms of like, genetic and the effects on our genes and anti-inflammatory pathways and so many cool things. So maybe you could talk a little bit about butyrate or just even the short chain fatty acids, or even and then of course more specifically, a lot of my people just want to know, okay, what do I do, right? I like to keep things super simple. So like, how do we boost our bifido? How do we boost our Akkermansia and all this other stuff? We could talk about that too.
Yeah, I mean, so a lot of people don't even know what is a short chain fatty acid. So think of it as the way that I explain it is if you have your gut and it's kind of like a factory, right? And there's employees that kind of work in that factory. The employees are their gut bacteria, right? And so they need to eat to survive and then to produce these wonderful byproducts. So what happens is when you eat a lot of food that's fermented or has plant-based fiber, because a lot of the fiber in food such as vegetables and fruits, we can't even digest. So it's almost like it's not food for us, it's food for them. And so when they digest that, the byproduct is these short chain fatty acids, right? It's the fermentation of plant-based fibers, or in the case of breast milk, which babies don't eat plant-based fibers, right? Breast milk has milk oligosaccharides, which also feed our gut bacteria. And as a result, they produce these postbiotics, which are short chain fatty acids. One of them is butyrate. Butyrate is great because it's been shown to not only strengthen the lining of the gut. So if you think about your gut and the lining, right? It's and I know you know this. I'm just kind of explaining it for whoever's listening. But if our gut is kind of, it's got tight junctions that kind of help to keep whatever's in there in, and what's absorbed and nutrients and things like that to go into the bloodstream. You want a tight junction in the gut. You don't want stuff leaking out. You don't want everything leaking out. You only want the good stuff leaking out. So when we have a lot of these beneficial gut microbes like bifidobacterium and Akkermansia and lactobacillus, it's almost like they take up the space in the gut, but then when you start depleting them, then bad bacteria start to kind of replace their position. And unfortunately, then you start producing less short chain fatty acids. And the short chain fatty acids are what really keep our gut lining healthy. But believe it or not, they're actually sending signals to our brain as well. And they're increasing the release of these amazing hormones, such as PYY, which is a satiety hormone. Another really big one is GLP-1, which a lot of people might say, you know what, why does that sound familiar? Well, this is how medications like Ozempic and Wegovy work, is they work on these GLP-1s, the satiety hormones, right? So we have something that's naturally being produced in our gut that's doing the same thing. So we want to increase bifidobacterium and all these really healthy microbes. And it sounds complicated, but it's really not. The best and most simple way to increase butyrate production. So butyrate is one of these postbiotics, right? Short chain fatty acids. The best way to increase it is eat foods that have really rich plant-based fibers, eat foods that are fermented, yogurts, kefir, things that already have these probiotics, so you're ingesting them. And that builds your gut naturally. So a lot of people will say, well, what about a supplement, right? A butyrate supplement. Um, and I'm not going to necessarily say that it's not going to help, but I don't think we have enough information. And I think everything, in my opinion, if it's produced by your body, it works better, right? Because I feel like whenever we take things externally, what happens is your body gets the signal that it doesn't need to make it as much. And this is kind of across the board with so many things. Is if you're giving your body an easy road and something externally, it's really not going to work as hard to make it itself.
Mm.
So you want to make butyrate on your own. You want to make all these short chain fatty acids on your own, because really that's what's stimulating your metabolic processes a little bit better. So my opinion anyway.
Yeah, absolutely. I think I'm glad you brought that up because I mean I've used the butyrate. I mean as a supplement, but I just to try it, and I know there's a lot of patients who benefit from it. But as you mentioned, I think it's best to do it in a very prescriptive fashion for a limited term until you can get your own body back on track for sure. But I'd say 99% of my patients, I just kind of do it like you said, just naturally trying to do it with foods and things like that. So
Yeah.
this is something too. Just before I don't want to say just off topic, but something I read about. I always try to read both sides of different stories, and of course, you read different things about with fermented foods and even vegetables, right? You hear there's two camps, right? Of course, like I'm a big fan. I think fermented foods are fantastic, but there's a whole camp and a whole bunch of researchers and people talking about fermented foods, how it's not good because it's too much lactic acid for your system and can maybe it's high FODMAPs or maybe it can irritate your gut, blah blah blah. And other people like you and I and have said, fermented foods are great for the gut. So I guess as with everything, everybody's different, right? If you fermented foods and you notice your stomach's upset or whatever, but the whole kind of too acidic, too much lactic acid and some inflammation. I'm not really familiar with a lot of research on that. I'm sure it's out there. These researchers wouldn't be talking about it, but in the same debate with vegetables, right? A lot of people are, and I definitely would talk about that later with diets, because of course there's one camp of like, eat your fiber, eat your fruits and vegetables. Another camp was like, well, all these phytates and lectins and FODMAPs, and it's irritating your gut. The whole carnivore community, it's like it's irritating your gut. Don't eat vegetables, right? Or just eat fruit and meat, So definitely two camps. We can talk about it an hour later, but I was just thinking about that. Talk about fermented foods.
Yeah. I mean, I know those camps, and the way I see it is, if you eat a moderation of everything, and you don't restrict yourself, you're really not going to get into any trouble. But you want to really make your meals predominantly plant-based. And I know there is a camp where they say, oh no, it's high FODMAP, and a lot of people are allergic and they get reactions. And this is where I think it's important to understand that, yes, we are all unique and we do have different reactions to food. So if you're somebody maybe who doesn't tolerate a high FODMAP, then start with a low FODMAP diet. But I think this is really where a gut analysis plays a really big role in how you customize your specific eating plan. So I think generally, if we're going to talk about general diets, we know from just numerous studies that Mediterranean type diet has been shown to have the best decrease in mortality compared to any other diet. And this has been studied over and over again. So what is in a plant-based diet? I mean, in a Mediterranean diet, which is mostly plant-based. It's mostly plant-based. You're eating a lot of foods that are fermented. There's olive oil, olives, very rich in that. And then there's a little bit of animal protein. So yes, you're having animal protein, but you're not having it on a daily basis. And the interesting thing is people who eat Mediterranean style diets, like people who live in the blue zones, they're also doing other things that we sometimes neglect to mention, such as, they're very social and they're eating together and they have like strong knit communities and they're doing a lot of exercising in the terms of walking. It's not necessarily, really high impact exercises. They're just doing a lot of walking, socializing. And I think that also plays a role. So, and these have actually been shown to impact our gut microbiome too. So, and I'm a big believer in, where your ancestors came from and what they ate kind of also influences your diet. If you look at people who are Asian or a lot of African descent individuals are lactose intolerant. And if you think back as to why are they lactose intolerant, whereas like most Northern Europeans or people with that ancestry are not. It looks like it's from the cows years and years and years ago who became sick in really hot climates. And then their milk production wasn't as healthy as cows who were living in, Norway, for example, right, where their milk wasn't getting spoiled. And, spoiled milk obviously grows not the best, type of organisms. And so this is where we have that. So I'm a big believer in, yes, we are very unique and individualized. So a gut microbiome analysis is important because it kind of tells us that, but also follow your gut, so to speak, in what you react to. Make a daily, sheet where you write down the foods that you're tolerant of and the foods that you're intolerant of and kind of work your way into healing your gut that way.
That's awesome. I love that. And I'm glad you mentioned that because that was one of my follow-up questions down later on was to ask you about like gut testing, because I know I've done it and I've done it for some of my patients, although I know some people say it's kind of a waste of time because your gut can change quickly. You could change it within a few days, kind of thing. And same with, food sensitivity testing, so I was going to ask your thoughts on those types of tests, but it sounds like you're a believer in doing them if necessary.
Yeah, I'm definitely pro gut analysis. And yes, you're right. Our microbiome does change dramatically, but there are these organisms that are pretty consistent. And, it's the ones that I mentioned earlier. And you want those guys, you want the good guys. And we know that some aren't so good. So we want to see what there is. And then there's a huge variety based on geography, based on what people are eating. So yes, I agree with you on that. But I think a gut microbiome analysis also kind of helps us to see a little bit of a picture of what's going on with you health-wise. And not all gut analysis are obviously created equally. So the one that I use is I like a lot because it gives you a really detailed analysis of your risks of certain conditions, what the ratio is, what to do to improve. So I personally think it should be routine with everyone.
Yeah,
hopefully
awesome.
in the future it'll be. Yeah.
Awesome. Now, what's your and there's been a lot of studies talking about it, and I definitely want to talk a little bit more since I both do a lot of things with weight loss, and I want to talk about fasting. But before we get to that, I want to talk about like a little bit more about the diets, right? And I know because there's been some studies, especially talking about different bacteria in the gut, and again, it's really hard to get specific things up or down, right? But it's like there's different things in terms of like the ratios, right? Sure, talk about bifido versus the Firmicutes ratios and obesity or just overall gut health, good or bad. How do you balance that out? Same with the ones you were talking about, lactobacillus and Akkermansia. But what's your take on some of these quote unquote, these ratios, the bad obesity bugs versus that kind of stuff?
Yeah, again, I mean, we don't know a lot about the gut. So it's almost like we're kind of just looking at the data over the past few years and seeing. But what we do know is we do know the good guys. There are some strains of Firmicutes which are not good. And I think the general consensus is Firmicutes is a bad gut bacteria, and the ratio of that having it more than the good guys is not good. It affects your glucose metabolism, blood glucose control, and it's more common in people who eat processed foods and who are overweight. But I've also seen studies where like certain strains of Firmicutes are not necessarily bad, and they're butyrate producers. So it's one of those things where you kind of have to take everything with a grain of salt because medicine changes over the years. But yeah, as a general consensus, Firmicutes is a bad guy. And lactobacillus, Akkermansia, and bifido are good guys. So what we know now is diversity, increased diversity is really good. So the more diverse your gut is, the more strains you have, and probably because we really don't know the function of all of them, but they're like a team in your gut, and they all work well together, the good guys anyway. So like lactobacillus and bifidobacterium have this synergistic team effort kind of thing where lactobacillus feeds bifido. So what we want is, we know that processed foods that are, rich in sugary substances, refined carbs, are not allowing our body to make more of these beneficial gut microbes.
That's awesome. Thank you. Are there any other specific things you recommend for people to, whether or not they have some gut issues, but or it's just weight loss or just general health, to augment the, quote unquote, the good guys, right? In terms of, obviously fermented foods, plant-based diet, any other specific nutrients or food sources that you recommend for like Akkermansia, Lactobacillus bifido, other than the plant fibers, hickory root, vegetables, things like that?
In terms of Akkermansia, what's been studied to show an increase in Akkermansia is apples with their skins on. And I think I learned this from Joel.
Joel, his apple peel protocol.
Yeah, he's very pro apple skins. Yeah, absolutely. And cranberries are really good in increasing Akkermansia. Bifido, the big ones are onions, garlic, artichokes, asparagus. They all contain inulin, which is a great plant-based fiber. And then, the probiotic stuff like kefir and yogurt help to increase bifido, but also lactobacillus. Lactobacillus is very rich in yogurt, like dairy or like yogurt types.
Right.
And I'm sorry, what was your other question in terms of food and what else?
I think that was the big one. Yeah. And speaking of that, and again, this is a kind of a side note. I was thinking about like myself personally, in terms of like the gut testing. Have you done much in terms of like the higher end sensitivity tests, like the Cyrex panels for like glutenins and IgG reactions and things with foods? Have you used that much or know much about that?
I will go to those if I'm kind of perplexed by the gut analysis or it suggests for me to do more testing. But the one that I use is a really good one, because it actually even will sense if there's H. pylori in your gut, and it'll kind of tell you like there's a gluten issue here, and then you can do further testing. So the problem is insurance doesn't really cover for a lot of these things. So
Right.
I try to be mindful for my patients. So I kind of take my background as an MD and having practiced traditional internal medicine and really kind of getting to know my patients when I do a wellness exam and really getting to know their medical conditions, and then applying the gut alongside with that and the holistic measures.
Mm-hmm.
But I try to be mindful of, because not everyone has a dispensary to pay for all these extra tests, which is unfortunate that it's not covered.
I know.
There's all this other garbage that's covered, like gastric bypass surgery is covered by insurance, but not a wellness or weight loss program, which makes sense to me.
No.
Yeah. So.
Okay. Interesting. Okay.
Yeah.
Well, let's talk a little bit about, if you're okay with it, we could talk about, I'd love to, get your take on some of the diets we talked about, or even we can get into weight loss and fasting. I know you're a big proponent of fasting. We could talk a little bit about some things that are for you with your clients with weight loss, like some of your strategies and things like that.
Yeah. I mean, everyone I see has kind of a different plan based on a gut brain assessment that I do. So, I don't know if have you heard of Dr. Braverman? Psychiatrist.
Yep.
Yeah.
Mm-hmm. Yep.
So he kind of came up with this like a gut brain axis thing where he talks about the four main neurotransmitters that we make: dopamine, acetylcholine, serotonin, and GABA.
Right.
And how we're all kind of dominant in one or two, right? And kind of dictates our personality. And then how we become deficient based on the fact that, either we're just not making enough. And so I do a similar approach when I do my wellness evaluations, where I will look and kind of determine what deficiencies you have based on what you're eating, really. So, if you're not eating a lot of tryptophan rich foods, you're not going to be making serotonin, because we know tryptophan is the precursor of serotonin.
Right.
So I look at that, and sometimes I'll check for urine neurotransmitters just to see what's going on, and then based on that, I will recommend, like a specific diet for you. But I am a very big proponent of fasting, even if you're just doing it for 12 hours. I'm not a fan of prolonged fasts. I'm not a fan of like the juice type fast because
Yeah.
I feel like you start to lose muscle,
Right.
um, and your body, yes, it's equipped with survival mechanisms for when you don't eat, but usually for short term, like less than 72 hours. And I'm really not a fan of fasts that are longer than 36 hours unless they're controlled, with, a doctor and their specific reasons. But yeah, I usually recommend to all my patients to do at least a 12-hour fast. Optimal is 18 hours because, we know that that's when the immune benefits start to kick in. Like 18 to 20 hours, you start to see a process called autophagy, which is when your cells start to realize you're not feeding them, right? And then your body's like, oh, I don't know what's going on. She's not eating. I need to figure out how to like reserve this energy, right? Preserve this energy. And so it kicks into this autophagy, which I call like low battery mode for your body,
Hmm.
because your body's putting itself in low battery mode and it's figuring out what it needs to preserve its energy for. So it starts to kill off all these cells that are either getting old, dysfunctional, really not, functioning properly. And so you're getting rid of all these dysfunctional, possibly precancerous cells, and you're left with these great, like brand new, shiny cells. And so I think autophagy is a really good way of you to stimulate your immune health. And this really doesn't kick in before 20 hours of fasting, 18 to 20 hours. So my usual recommendation is start low, because with everything, everyone needs rest. Your gut needs rest too. And if you're constantly eating, even eating right before you sleep, your gut is going to have to work on digesting foods during the night when there's so much other stuff that it needs to do. So yeah, usually I'll recommend like a restricted time eating, 16 to 18 hours. And I'll tell people to get urine strips, check for ketones, because we're all kind of different. So what you want is the fat burning mode of ketosis, right?
Right.
So if you're checking your urine, some people, become ketotic in 18 hours. Some need a little bit longer, but usually once you start kicking into ketosis, shortly after you're going into autophagy, which is that low battery mode of
Right.
your body. So,
Yeah, I love
a lot of tweaking, it's not rocket science, but at the same time, it's not science that is the same for everyone.
that.
So
Yeah. I agree. I kind of do the same thing. I recommend, some kind of time restricted eating on a daily basis, even if it's just, like you said, 13, 15 hours, but maybe once a week, do a longer fast, 20 hours, 24 hours or more. If you weight loss is the goal, you could do it a couple times a week. But
yeah,
I'm like you, me personally, I like to eat, so I don't do as much as I should.
yeah,
And I mean,
true.
I think I've done like a 20 before. I don't think I've ever done a 24, but one of these days I keep telling myself I'm going to do like a 24, 48, something,
Yeah.
maybe a 36. But I agree with you. I think the data shows that after 36, you can risk losing muscle mass. So I tend not to recommend that too much.
Yeah. I don't even know if you necessarily need more than 36. I mean, it's like, I don't want to plug like different things, but there is a program. It's actually studied. It's a long-term fast, not long-term, but it's 5 days, but you're eating food.
Oh, the
And
Prolon.
yeah, Prolon.
Yeah.
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 I think that's the only one that I would recommend as a Prolon, because you're actually eating.
Right.
And it's been, I know Dr. Longo, who started Prolon, has done a lot of research on fasting. So
Right.
that's really the only one that I would recommend long term.
Yeah.
But, I'm like you. I mean, my body's really gotten used to doing at least 16 hours every day. Sometimes on the weekends, I don't necessarily do 16 hours, but I try to do 16 to 18 at least 5 days a week.
Yeah.
And then, I will do like a 24 hours, not that bad. Do it on a day where like you had a heavy dinner the night before, for example, and you just kind of wait until the next day to eat. But 24 hours is really where you're optimizing autophagy. But
Yep.
yeah, I'm not a big fan of longer term fast either. And I know a lot of people are like, do the juice thing and the 3 day fast. I have no idea how people do that. How do people like not eat for 3 days? I don't know.
I know people do it, and I'm like, I don't know. I think
Yeah.
it's kind of funny. You're probably like me. We've both been around and seen a lot of different things through the years, and seeing the trends. And like I remember I grew up during the whole low fat thing, and my dad was on that because of his cholesterol issues. And now we've learned that, it's not always the best thing. Some people, like, although me personally, I do better on a lower fat diet, this because my gut. But other
Yeah.
people, but we've learned that low fat is not bad, kind of thing. And same thing with
Yeah.
fasting. It's like now it used to be like more same thing like when I was in college, it was more like everybody's big on like kind of the bodybuilder style, eating like multiple times a day. And now it's like
Yeah.
fasting, but now I feel like it's gone. So many people are taking it to the extreme. I feel like it's going to come back. There's all, like as you mentioned, it's all about the balance, right? And balancing
It
things out.
really is. Yeah. And I know this is going to sound controversial, but I mean, a lot of these bodybuilder types didn't do so well with COVID. And I
Yeah.
think a part of it is, I mean, if you're doing it for like a short-term thing, to kick into like,
Right.
that's fine. But if you're doing it as a long-term, really maintenance, it's not good for your gut. I mean, you're
Right.
not eating any plant-based fibers, and you need those plant-based fibers. We just talked about this. So, if you're eating just like fat and protein all the time, it's really not good for your gut. It might be great for weight loss, but your gut's
Yeah.
probably,
I talk a lot of patients are that, same thing with the whole keto thing. I'm not a big keto fan. Number
yeah,
one, I can't do it. But number two, for my patients, I tell them, I said, like you said, for short term, for weight loss, but I don't think it's a
yeah,
long-term diet just for gut
not
health
sustainable.
reasons. And
Yeah,
I've seen people have some metabolic issues of being on it too long. And same thing with the whole carnivore thing. It's kind of like,
yeah,
I have some colleagues and friends who use it and promote it and talk about it, but I don't really know if that's a great long-term plan either because of the lack of diversity and variety in your diet. And who knows? We'll see.
yeah. Short term, it's great, if you want to kickstart weight loss. But what I tell my patients is, yes, ketosis is great, but induce it through fasting, not through
Hmm.
strictly only keto diet.
Right.
Because then with fasting, you're getting if you're eating like a varied diet, you're getting those plant-based fibers and you're kicking into ketosis. So it's a twofer. So
Yes.
you're
Yeah.
getting the best of both worlds.
I love that. I love your talk about the thing, especially with viruses and COVIDs and the gut bacteria, because I agree with that 100%. I think, there's many ways, and I don't know about you. Are you dealing with a lot of post-COVID long haul type patients and working with them?
Yeah, goes down to the gut again. I
Yeah.
mean, the gut is the key to a lot of stuff, like you said. Hippocrates knew it back then, and maybe it was easier for him to pinpoint it. But there wasn't a lot of information out there, and he kind of saw what he saw with his patients. But yeah, I mean, it really kind of all goes back to the gut. And if your gut is healthy and you're feeding it properly, it's going to do amazing things for you.
Are you doing anything different for the long haul patients in terms of your protocol?
Um,
Kind of the
yeah,
same
we're
thing.
working on their gut. We're doing a lot of like antioxidant rich stuff, vitamin D, quercetin is another big one that I like for long COVID. Definitely if you have long COVID symptoms, get a gut analysis so we can see what's going on and try to enrich your strains. And it's so interesting. Like I had a patient who was complaining of a lot of yeast infections, and when we looked at her gut, she was so low on lactobacillus,
Mm,
which is very important for vaginal health. And so we
right.
started recommending an increase in lactobacillus, but also lactobacillus helps to make serotonin too. So if you're having a little bit of depression and you're really not feeling your best, then you know what? Look at the gut. Let's look at the gut and
Yeah.
see what's going on.
For sure, for sure. Awesome. I have a couple gut questions. I'll ask you offline specifically, but just more personal type stuff. But I think that was a good overall summary. Is if there anything else if you want to talk about anything before I forget, if you want to mention your website or where people can find you, etc. on social media, if you want to throw that out real quick and plug anything
Sure.
you want to plug.
Yeah, I was when I was opening my practice, I was like, what should I call it? I didn't want to call it like my name. So I decided to call it From Within Medical because I feel like, it's a medical practice, but it's healing from within.
I
So
like
my
that.
website is www.fromwithinmedical.com. But yeah, I'm on Instagram too. And Dr. Christine B, doctor spelled out Christine B. But I did want to mention about because I get this question a lot about fasting, like, oh, it's not good for women, reproductive wise, blah, blah, blah. So yes, long-term fasts are not good for women. They're not good for anyone really.
Yeah.
But if you think about our ancestors, they didn't have, Whole Foods and, Trader Joe's at their dispensary. They had to really gather what they ate. And I'm 100% sure they weren't eating 3 meals a day.
Right.
So they were eating, breaking fasts, later in the day, they were eating 2 meals, if anything, or even one big meal. And
Mm.
so a lot of them were, fasting. And their reproductive health was fine. I mean, we had very fertile women back in the day. So what I say to women is, yes, long-term fasts are not good, but even a short-term fast, 12, if you're trying to get pregnant, probably not a good idea to fast, like severely, but 12 to 16 hours, if you're getting a good amount of nutrients in your diet during the times that you're eating, then fasting is not the problem.
Right.
So, shorter term restriction of time eating is not necessarily a bad thing, reproductive health wise, in my opinion. But I know there's like a lot of controversy about that, and there are people that disagree with me. But I'm sticking to what I'm saying is don't do a longer term restriction, but 16 hours is not going to affect your reproductive health, in my opinion.
I agree. I agree. And it kind of, you look at things like, they've been around for a while, people like talk about the warrior diet, or 2 meals a day or long, do a longer fast. And like you said, it's about that flipping that switch. And I think you could do any extreme for a short period of time, but it's where you get into trouble, I think, is doing the extremes all the time. I'm going to do 3 24-hour fasts this week, and I'm going to do Orange Theory every day, and I'm going to lift weights every day, and I'm going to do cold plunges every day. And I tell people it's like you're doing way too much at once. It's just you got to have a
Yeah,
balance. It's all about the balance.
absolutely. Your body wants to survive, and if it sees you doing that, it's going to think you're entering a famine,
Yeah,
or you're in a famine. And what is it going to do? It's trying to survive. It's going to hold on to more fat because it doesn't see that you're doing this to diet and look great. You're doing this to it. It's I don't know what's going on. There's shortage of food. Let me hold on
right,
to
right.
extra fat. So
I
yeah,
think I think it's. I was actually reading an article last night from a doctor, one of a well-known guy who's of course been censored a lot in the media, and because of talks about the stuff that we talk about, health,
yeah,
preventive health, and but just talking about a lot of these long-term adaptations of our body and a lot of these syndromes that we're seeing nowadays. This rise of all these autoimmune conditions and gut issues, and all these things, and it's like, well, it's because a lot of not in the old days it used to be, disease A causes this, you treat it with treatment B. And now it's a little more complex because I think a lot of what the article was talking about is how our body, a lot of these things are just on a cellular level, mitochondrial level, just kind of
yeah,
physiologic adaptations gone awry because it's just too much for too long and our body's adapting to it. So it's a lot of things to address. It's not just one thing. And, because of the fact that, our bodies are, we've only been around for so long, but our environment has changed so much faster in the last number of decades, our body just can't keep up. So that's why, not to get off on tangents, but we see all these, all the EMF, electronics, all the shots and vaccines and the chemicals and the food and just all this stuff, and in really not that long a time frame, really since like the early 1900s, and our bodies just can't adapt to that so quickly. So look at the rise of, like I said, all these conditions, fibromyalgia and autism and autoimmune conditions, Hashimoto's and all these different things. It's like, it's multifactorial, and it's going to be a multifactorial treatment plan. There's no one quick fix. So,
I agree with you absolutely, and I think it's definitely our environment, what we're eating. I mean, you look at sub-Saharan Africa, and they don't have access to a lot of medical, uh, just access to medical
right.
care that we do. And they have the lowest incidence of colon cancer.
Yeah.
And, like, I don't know if you've heard of the Hadza tribe. Have you ever
Hmm.
heard of them?
Yep.
Yeah, the Hadza
Yeah.
tribe has no access to medical care at
No.
all. And they're one of the healthiest. They have like very limited access, but there's like zilch diabetes and other metabolic conditions because they're eating what they hunt, they're eating what is in their environment, and they're exercising in the wild.
Yeah.
So
Yeah.
we as industrialized nations have not done well. And I think I read somewhere by 2035, 50% of the global population is going to be considered obese,
Wow.
which is very scary.
That is scary.
And our children, I mean, in the US, I think 40% of individuals are already obese.
Yeah. Yeah. It's
And
huge.
Yeah, it's rising in children. And we want to talk about real issues with reproductive health is everyone that's being diagnosed with PCOS and all
Mhm.
these metabolic conditions in young kids that we never saw before.
Yeah.
So
Yeah.
that's what's scary. That's the real pandemic.
It is, and I think it goes back to the basics, like you and I were both talking about. With the blue zones, is kind of getting back to our ancestral nature of constant movement through the day, eating real food, being social, slowing down, getting away from the damn computers. Being talking to people, relaxing, enjoying life, and getting outside. That's what it's all about, and that we've gotten away from that. So
I agree. I agree. We need to go back to the basics.
yeah, for sure, for
Live
sure.
like our grandparents lived.
Yeah,
Yeah.
absolutely. I agree 100%. Well, I want to be cognizant of your time. I want to wrap. We'll wrap it up. One last quick question for you. I always ask this of all my guests, but is there any good non-medical books or anything that you're reading right now?
Okay. You know what? I'm gonna plug Dr. Russell Kennedy. It's kind of a medical, but it's more like mental wellness. He wrote a book about anxiety. It's called Anxiety RX. I don't know if you've heard of him.
No.
Yeah, so he's a psychiatrist who suffered with anxiety, and really all the treatment options weren't helping him. And then his book is based, I just started reading it, but his book is based on the fact that anxiety, a lot of people talk about it's the brain, but it's really more of your body. It's like an alarm system in your body that's triggered from something in childhood, and it's the opposite. It's your body's triggering your brain to react.
Got it.
So people are always talking about like therapy and brain and like
Mhm.
mental and psychological and all these therapies, but he's like, none of that will work if you don't treat the trigger, the alarm. So yeah, that's what I'm reading now. It's not medical, but
Yeah.
I like to delve into a lot of stuff.
Yeah,
So
that's awesome. That's awesome. Cool. Good to know. Good to know. Well, thank you again for jumping on the show. I appreciate it, and I'll look forward to spreading the word about what you do to everybody, and have an awesome week.
thank you so much. You as well.
All right.